Hi, I'm Dr. Geeta Chadha, working as a senior consultant in obstetrics and gynecology at Apollo Cradle Royale and Indraprastha Apollo Hospital. Today, in this video of 4 minutes, I'll be giving you a brief overlay about fibroids in the uterus. Now, what really are fibroids in the uterus? See, ever since the ultrasonography has become common practice in day-to-day gynae, many patients have an ultrasound and where they're told they have fibroids, and that sets an alarm and they become worried. First of all, I want to say that if you do not have any symptoms and if a routine ultrasound shows fibroids which is small and not bothering you, you don't need to worry. It was found that 70% of Egyptian mummies who were worried were found to have fibroids. Whether they were symptomatic or no has not been recorded. So they have been there in a human body since time immemorial. Now, if a fibroid is bothering you, what are the various ways in which it will show up or in which way they will show up? First is they may present as abnormal uterine bleeding. A woman may say, "Doctor, I bleed too heavy, I bleed too long, I'm flooding out and I'm having clots. At the end of every cycle, I feel weak." Now this we call abnormal uterine bleeding. If that occurs, of course, whether fibroid or no fibroid, you need to go to your doctor to elicit a cause, and if fibroids are found, they are a very important contributory factor to causing abnormal bleeding. Another presentation would be a huge fibroid may present as a pressure symptoms. They may be as big as a 4 or a 5 month sized baby, and you could be having a tummy which is popping out, feeling pressure on the ureters, thus causing a back pressure on the kidney and also causing pressure on the rectum. So this in today's time is rare but still seen, where a young girl is completely oblivious of the fact that she's sitting on such a huge tumor, so a pressure effect may be seen. Some women may come with infertility, that means they are not able to get pregnant and there is a fibroid which would be pressing on the tubes. Now once you figure out what is a fibroid and what it's causing, then there are various treatment modalities ranging from either doing nothing for small asymptomatic fibroids to surgical removal, whereby we either remove the whole uterus with a fibroid, or surgical removal of just fibroids where a woman wants to retain her uterus for reproductive function, or just that she feels she's too young to remove the uterus, then isolated removal of the fibroid is done, or hysteroscopic removal where a fibroid is just seen in the cavity. You don't need to go through the abdominal route, you just put in a scope through the vaginal remove and it's very easy to remove the fibroid. Other methods are some medicines which have come up which have to be given with care, because no medicine is without a side effect. They shrink the fibroid for some time, but the minute you stop the medicines, these fibroids can sometimes grow back. Coming to uterine artery embolization, whereby you just cut the blood supply to the fibroid, hoping that when the fibroid doesn't get the blood, it will undergo necrosis and start shrinking. So treatment modalities are something which a doctor would have to individualize based upon your requirement of keeping the uterus, reproduction and symptoms. But suffice it to say, fibroids are no longer such a big thing. They are easily manageable with today's surgical practices. Hope this video was of some use to you. Thank you for listening.